Okay. Now, if you don't have the phosphorus, because once again, it is going to be the PTH in the renals that's going to excrete the phosphate. What about the PTH working on the bone? What do you know about that? It resorbs, meaning that it activates your osteoclast so that you can resorb the calcium. All right, so it'll start breaking down the bone a little bit. What about mineralization? Do you think that'll take place? Absolutely not. Why? You might have the calcium, but what about the phosphorus? Down the tubes, literally, flushing it down the toilet, aren't you? Who's causing that? The phosphate. I mean the PTH. All right? So, let's go through this little picture. I keep reiterating this because this is an important point. So you have vitamin D deficiency. You have decreased levels of your activated vitamin D. You have decreased levels of both calcium and phosphate in your blood. So what will it do to the PTH? It will increase your levels of PTH. All right, so it'll do two things. The PTH will cause release of your calcium from your bones, and it will also flush the phosphate. It'll open up the faucet to flush the phosphate down the toilet or down the sink. All right, so PTH will open up the faucet to flush your phosphate. And in essence, what happens to your bone? You have decreased both calcium and phosphate, so therefore mineralization does not take place. Even if you have the calcium, it doesn't matter. Without that phosphate, you cannot mineralize. You can't deposit anywhere, and that is the point of this. Now let's go on to how it affects the children, which is much more severe than how it will affect the adults. In adults, it'll be more or less remodeling, because at that point, the mineralization of the bones has already taken place. Primary, secondary ossification has already taken place. If it's children, the mineralization has no chance of taking place. Two types. I'm not going to spend any time on intermembranous. There's two types of ossification. I need you to understand this, a little bit of embryo now, so that you can understand the pathology well. Because we're going to do vitamin C, and once again there, you need to understand the terms. All right. Intermembranous ossification, your flat bones, nothing much there. It's a very simple process, so you can read that on your own. Endochondral. This is the big one. Endochondral will be for your long bones. Endochondral ossification. Initially, please pay attention. I can't lose you here. I cannot lose you here. Initially, in an embryo, the type of bone, it's not even a bone, it's a cartilage. It's hyaline cartilage. When it's hyaline cartilage, initially, remember we're doing endochondral ossification here. Okay. Initially, there is perichondrium. What's chondrium? Is chondrium cartilage or is that bone? It's cartilage. All right. So you have perichondrium. The whole thing is hyaline cartilage, and you have perichondrium. It's all in essence cartilage. Next, what ends up happening is that the perichondrium will be replaced by periosteum. What's osteum? Bone. Please pay attention. I'm telling you this for a reason, because in vitamin C we'll see periosteal bleeding, and that's so key. Right now we're still vitamin D, so that's easy for you to differentiate. So perichondrium, cartilage. At first, the perichondrium gets replaced by periosteum, which is a compact bone. And then, listen to me first, and we'll take a look at the pictures. Then that cartilage in the middle, in the diaphysis, disintegrates. That disintegrates, and it gets replaced by spongy bone. Who's making that spongy bone? Osteoblasts. So the cartilage gets replaced by osteoblasts. That's your primary ossification center. We'll see pictures of this. Just pay attention right now. Now, that spongy bone in the diaphysis gets disintegrated by osteoclasts, and you end up forming, in adults, what is in the middle of your long bone? Is it filled with bone or is it hollow? It's your bone marrow. It's your medullary cavity. It's your medullary cavity. So once again, the cartilage gets replaced Second, your primary ossification center in the diaphysis gets replaced. And then thirdly, you have a secondary ossification center, and that's in your epiphysis. And that's where I need to spend a little bit of time, so let's do this. Everything here is in words. I'd like to once again show you pictures. All right, so here initially is your hyaline cartilage. Hyaline cartilage. This right here, please look up here. This is your perichondrium initially. Remember, the whole thing's cartilage. Then you have osteoblasts which come in and form your periosteum. Periosteum. Next, this is your primary ossification center. What does that mean? Primary ossification center means that the blood vessels have come in, bringing in your osteoblasts so that you can form your spongy bone. You have osteoblasts in here. And please know that this entire process, you need to have calcium and phosphorus so that you have mineralization taking place. That's what we're alluding to. Next, here is your secondary ossification center in your epiphysis. That's what this is pointing to right here, secondary ossification center. And then see, look, take a look at this. The spongy bone gets disintegrated to form a medullary cavity. That makes sense. Initially in a fetus, what kind of marrow do you have? Do you have red marrow or yellow marrow? Yeah, exactly, red, because that's a medullary cavity. But then here, secondary ossification center has your spongy bone. Eventually, the entire cartilage is replaced by bone. What kind of bone? Mineralized bone, so that you can both have calcium and phosphate. The two areas that cartilage still remains is your metaphysis, also known as your epiphyseal plate, and this is what you need to know. So remember, this entire structure is being replaced. The cartilage is being replaced by mineralized bone. What is causing that mineralization? Well, first of all, it's the osteoblasts that are bringing in both, which have the calcium and the phosphate. So please keep that in mind. The two areas in which you have cartilage still remaining will be the articular surface and the metaphysis, or the epiphyseal plate. Now let's take a look at the deficiencies. Rickets. Rickets. With rickets, you have deficiency of who? What's the big picture? Vitamin D. All right, if you don't have the vitamin D, you can't reabsorb the calcium and the phosphate, you can't mineralize. So what type of matrix are you going to deposit? Unmineralized matrix. What is so important of mineralization? We'll get to that in a second. Because initially, what did we say? It was a cartilage, right? What happened to that cartilage? It gets replaced. Majority of that gets replaced, except where? Metaphysis and the articular surface. All right, now this little slide tells you why mineralization is so important. And I'll show you slides so that it'll make better sense. Mineralization in red, formation of bone along remaining walls of calcified cartilage matrix. And then what the mineralization does is, if you don't have that mineralization, you can't replace the cartilage. Are you guys with me? If you don't have the mineralization, you can't replace the cartilage. If you don't have mineralization, initially, you can't even form strong spongy bone. So you can't form the strong spongy bone because you don't have mineralization. And then as you're growing, remember, this is in a child. This is in a child. The mineralization cannot get rid of the cartilage. What do I mean by that? Well, let me show you this. So the osteoid, let me go through this real quick. Osteoid matrix deposition on inadequately mineralized cartilaginous remnants. So that osteoid, okay, osteoid will be the unmineralized. This is rickets. So you don't have calcium and phosphate. So you still have the matrix, but it's being deposited onto the inadequately mineralized cartilaginous remnants. And then because you can't get rid of the cartilage, you will actually have expansion. If you can't disagree, you need to get rid of the cartilage so that you can form new bone. If you don't get rid of the cartilage, then what are you going to have? You're going to have lateral expansion of the osteochondral junction. We'll see pictures of that. And then, this is the bottom line. Skeletal deformities and loss of rigidity. Because you cannot form your strong bone. Where's that picture? Okay, so I'm going to show you microscopically. So let's go through the non-ambulatory. What does that mean? This is a patient who is moving or not moving, or a child. Non-ambulatory, all right, not moving. So in essence, we have formed a type of bone that is extremely weak. Why? Because you don't have mineralization. What does mineralization mean? Once again, you don't have the calcium and the phosphate. Why do you need the mineralization? So that you can get rid of the cartilage. If you can't get rid of the cartilage, what ends up happening? You have overgrowth. But that overgrowth, is that strong overgrowth or weak overgrowth? Very, very weak. All right, skeletal rigidity or vulnerability. Now let's take a look at the baby. Occipital bones are flat. This is known as craniotabes. German, skull, tabes, Latin, wasting. Occipital bone is flat. The parietal bones, they're weak. They're weak. They get pulled in. It's craniotabes. They get pulled in because of the pressure, and then it pops out. That's what craniotabes is. Why is it even able to do that? What kind of bone is that? Extremely weak bone. Frontal bossing, what does that mean? Remember, you have overgrowth of the bone. The forehead is protruding outwards. So we'll see pictures of that. It's bossing, protruding outwards of what? Of your frontal bone. And then we'll see rachitic rosary. At the osteochondral junction of your ribs, okay, you have expansion. And it's called rachitic rosary. Be careful with this though. Rachitic rosary you can also see with vitamin C deficiency. Once again, get proper history from your patient. Find out what's going on. Is this baby in lack of sunlight? Is this baby in lack of fruits? Okay. So simple things like that. It'll tell you a lot. Pigeon breast deformity, also known as pectus, what? Carinatum or excavatum? Carinatum. The bow of a boat or a ship. Or carinatum. The sternum is protruding outwards. Why? Because the ribs are weak. And as the baby's breathing, pay attention, as the baby's breathing, the ribs are being pulled inward. What else do you see with the ribs? Rachitic rosary, you see that? And you also see pulling of the ribs inward. If you pull the ribs inward, who's going to protrude outward? The sternum, carinatum. Pigeon breast deformity. Harrison groove, I'm not going to spend time there. Ambulating child. Ambulating child, a moving child, and here, lumbar lordosis. Take a look at the child on the right. I get that right? All right, so this is a summary and anatomy a little bit. In case you've forgotten, here's your diaphysis. Here's the medullary cavity. Here, spongy bone, still being retained. Remember, this is normal, mineralized. Here's your epiphyseal plate or metaphysis. Here's your articular surface. Is that cartilage or is that bone? That's cartilage. That's cartilage because growth still has to be taking place. This is where secondary ossification is. What you would see with the child, frontal bossing or protruding forehead. Pigeon chest, also known as what? Carinatum, kyphosis. We'll see the wrists. What about the legs? Remember, it's pressure now at this point, right? So is the baby able to walk well with strength? What happens to the bone if it's weak? Bowing of your long bones. Remember, it's endochondral ossification that gets affected the most. Endochondral, where's that taking place? Flat bone or long bone? Long bone. All right, radial overgrowth. Why? Osteochondral junction, lateral expansion. Is that weak bone? Yeah, it's weak bone. Bowing, what it looks like radiographically. In case you're not seeing it here, this is a baby, obviously. And there's bowing. All right, that's what I'm referring to. Pigeon chest, carinatum. Take a look at this on X-ray. That's the sternum protruding out. Carinatum. Once again, here, oh, it's asymmetrical. How many sternums do you have? One. How about that? So is it going to be symmetrical? Absolutely not. Asymmetrical. Take a look at that. Here's frontal bossing. Sad.